welcome back to my channel. Today I'm going to start with another topic, that is your Paget's disease. Last video was on cleidocranial dysplasia. After this we're starting Paget's disease. So let's read what Paget's disease is, and this has been asked for a 5 marker, so please pay attention. Let us begin. Paget's disease of the bone is a condition that is characterized by abnormal characteristic resorption of and deposition of bone, resulting in distortion and weakening of the affected bones. So this is a kind of disease that occurs in older adults, okay, and it is a condition which is characterized by resorption and deposition of bone, resulting in distortion and weakening of affected bones. So there is distortion of the affected bones, weakening of the affected bones, okay. Now coming to the etiology. Etiology is unknown. Inflammatory, genetic, endocrinal factors should be taken in consideration but cannot be considered the etiology, okay. Then recurrent mutation is seen in gene SQSTM1, okay. Here if you do not mention the gene, it is okay. You can just write there is a recurrent mutation in sequestron gene 1, okay, or you can just write that there is a gene mutation and which participates in the regulation of osteoclastic activity. Then there could be viral factors. Inclusion body identifies as nucleocapsid from paramyxovirus. So paramyxovirus also becomes a risk factor, and in osteoclasts with patients with Paget's disease. Autoimmune, connective tissue and vascular disorders. Clinical features, as I told you, older adults 50 plus. This disease is seen in 50 plus, usually male predilected, and it is predilected for occurring in England, France and Germany. Race is white predilection. Location is in the lumbar vertebrae, pelvis, and your skull, femur are commonly affected. Diseases could be polyostotic or monoostotic. Clinical presentation: polyostotic. For those of you who did not see a previous lecture, polyostotic means poly means many, bone, ostotic means bone. One bone. This is, we are talking about the bone involvement. Poly means many, mono means one. Then clinical presentation, how it is seen in the patients. It may be asymptomatic and we discovered accidentally on radiographs. Symptomatic is, if it is causing symptoms, it is usually bone pain which is having a complaint of worsening at night. Paget's bone often near the often forms near the joint. So there is something called Pagetic bone which forms near the joints and promotes osteoarthritic changes. Joint pain and limited mobility, which causes joint pain and limited mobility. So Pagetic bone often forms near the joints and causes osteoarthritic changes, joint pain and limited joint mobility. It affects the enlarged and weakened bones, leading to, so affected bones are enlarged and weakened. So the bones which are affected are enlarged and weakened. Involvement of weight bearing bones lead to bone deformities, that is bowing occurs, which is called simian stanel. Simian stanel means there is the monkey like bones. Basically the bones become short and hence it becomes monkey like. Paget's disease affecting the skull. Enlargement of skull occurs and frontal bone bossing is seen. Bossing, I have explained it in the previous video. Bossing is basically knob like appearance. Paget's disease affecting skull appears knob like in the frontal bone and increase in the circumference of the head. Softened bones at the base of the skull lead to platybasia. What is platybasia? Is descent of cranium into the cervical spine. Okay, descent of the cranium into the cervical spine. Skin over the affected bone is warm due to high blood supply. Facial bones involved are, in severe cases, may be causing lead to secondary complications such as headache, paresthesia, nerval involvement, hearing loss, optical nerve atrophy, blindness, neuralgia, facial palsy. Rarely, patients with Paget's disease may have cardiovascular anomalies, aortic stenosis, calcification of cardiovascular valves, and conduction abnormalities. So, basically, these and all are talking about the other bones other than your oral bones. Now coming to the oral manifestations, it is occurring more in maxilla than mandible. Unlike your cysts mainly occurs in mandible, but these manifestations are usually seen in the maxilla. Maxillary disease, enlargement of the middle third of the face is seen. In severe cases, alteration results in a lion-like face abnormality. It is known as leotinosis nasoossea. Okay, so basically lion-like face is seen. Secondary change is there is nasal obstruction, enlarged enlarged obliterated sinuses, then deviated septums, alveolar ridge widening, palate is flattened. Edentulous patients, there is enlargement of spalling teeth. Edentulous patients complain about tightening of dentures, and dentures do not fit is the main complaint why they come to the dentist. Then there is incompetency in lips. Lips do not close properly because there is enlarged jaws. Radiographic features, whole body radiographic survey is done so that the bones are scanned thoroughly to find out the abnormalities. Paget's disease occurs in phases. First phase is the osteoclastic phase, also known as the early lytic phase, where the destructive radiolucent areas are seen, which are single, multiple, or diffuse in radiographs affecting the bones. Isolated lesions in the skull, when enlarged, show osteoporosis circumscripta. What is osteoporosis circumscripta? That is a large lesion associated with skull. Okay, then mixed phase. After your osteoclastic phase comes the mixed phase, where there is mixed osteoclastic osteoblastic activity. Patchy bone is seen, and if you radiographically examine, the radiolucency is mixed. Radiolucency and radioopacity is seen. Now osteoblastic phase, where the osteoblasts form a patchy area of sclerotic bone and become confluent. Then there is cotton wool appearance because of the sclerotic areas. Okay, then enlargement of cortical plate is seen, cortical thickening, increased trabeculae, deformity, bowing of the bones is seen, and generalized hypercementosis of teeth is seen. Then it is usually bilateral. Early lesions are unilateral. Now coming to laboratory findings. Laboratory findings are total bone space. You do not have to write this part, you can skip it. Okay, there is specific serum alkaline phosphatase levels are elevated. Okay, serum alkaline phosphatase levels are elevated and serum calcium levels are normal. That are the two things that you need to know. Histopathology depends on the stages and disease progression. Initially osteoclytic phase, there is extensive resorption because of the osteoclasts, and abnormally large resorption occurs, and the osteoclasts are large, may contain as many as 100 nuclei. In the osteoblastic phase, small irregular fragments of newly formed woven bone is seen. They unite in a characteristic jigsaw puzzle pattern. So here something important, that is your jigsaw puzzle pattern is seen. Here mosaic pattern is seen. These both are your two markers, mosaic pattern and jigsaw puzzle pattern. Repeated bone resorption and subsequent bone formation results in a basophilic reversal lines, known as your mosaic pattern. Indicates the junction between the resorption and formation. Then you have your osteoblastic stage. In later stages, bone islands are compact, marrow spaces are filled with highly vascular fibrous tissue, and they do not show Haversian canals. Treatment is disease is slowly progressive and limited involvement. No symptoms, no treatment. If symptoms are there, NSAIDs are given. Bisphosphonates are given to reduce osteoclastic activity. Calcitonin inhibits osteoclastic activity. So sometimes you have to check the calcium levels and prescribe calcitonin to inhibit the osteoclastic activity. Complications: stress fractures, which are common in femur, sarcomatous degeneration, osteosarcoma, chondrosarcoma, and fibrosarcoma may develop, and giant cell tumor, cardiovascular abnormalities are seen. So this was about Paget's disease. Thank you so much, and if you understood something, give it a thumbs up. If not, thumbs down. Subscribe to my channel. Keep watching. Thank you.